Hi, I'm Dr. Elly Pourasef, audiologist and owner of Memorial Hearing in Houston, Texas. I went to the University of Texas in Austin and I got my doctorate of audiology in 2011. I did kind of the same tasks throughout the years and, help people hear better. But a few years ago, I had a coworker talk to me about earwax removal, and I saw that they were starting to post earwax removal videos. And so I kind of gave it some time because I wasn't trusting the process. I didn't know if this was something that I wanted to incorporate into my office. But once I watched her for about a year do that and post and talk about how amazing the Earigator was. And then after that, I felt comfortable to do it for myself. Once COVID hit, business was slow for a while. So I reached out to Newport with Earigator and I purchased my first machine back in October of 2020. I kind of wanted to dive into things and start filming, but I was a little bit uncomfortable with that. It's kind of scary to ask a patient to film, especially in the medical world with HIPAA and privacy violations. So for me, that was a comfort level that I had to get past. Once I got past that, we started filming. We wanted to amp up some business because it was slow. So we went and filmed our first few patients, did some edits, put it on TikTok, and it started to gain some traction. Probably by my third video, it went viral. I had about 20 million views and it was just crazy after that. Literally the phones did not stop ringing after that. I had hundreds of emails, hundreds of calls a day. We would stay at work till probably 8 o'clock at night every night just to deal with all of these calls and emails. It's literally been crazy. And now we're 2 years later and it still hasn't stopped. I gave it a little bit of time, but the calls still didn't stop. And because of that, I had to hire a third audiologist and a third patient care coordinator. So my office literally has grown because of the Earigator. For some reason, a lot of audiologists have a fear of removing earwax. It's within our scope of practice, but for some reason, it's just not something that a lot of us are comfortable doing. I think mostly because a lot of audiologists are in an audiology ENT type setting where the ear, nose, and throat doctor usually is the one that just ends up doing it. So I think we got kind of comfortable with that. And now, especially if you're in private practice, you don't have that. So you risk losing a patient by referring them to the ENT if a patient's ears are impacted with wax. And I'm not gonna lie, I was doing it too. I just did not want to deal with earwax. There was a time where my website development people were putting earwax removal as search term, like an organic search term, and we were getting calls about it. And I remember freaking out on them, like, why are you doing that? We don't do earwax removal here. I don't want any calls about earwax removal. And now literally that's practically like 75% of our business today is earwax removal because of the Earigator, but we weren't comfortable prior to that. And the main reason is I didn't want to do curettes because you're picking on people's ears. If they're on blood thinners, they're gonna bleed. I didn't want to do suction because it takes forever and it's very, very loud. And it's kind of scary to get a suction near the eardrum like that. And then I didn't want to do irrigation, standard irrigation, because the water is not warmed up and therefore the patient feels nauseous, they get dizzy and they want to throw up. Obviously I don't want anybody throwing up on me, so I didn't want to deal with earwax removal naturally. So that was that. But once we got a hold of the Earigator and we saw that people were happy, they felt like it was like an ear spa. They would use the term, this is like a spa for my ears. I mean, that's a big difference to go from not being comfortable with something to doing that most of your day, and people calling all the time for it. People are flying in from other states to see us. I mean, as much as I love the business, I think it's insane that somebody flew from California to come to see us and got a hotel and an Uber just for earwax removal. Like, audiologists all over the country should have this machine, and that way they're on the locator map and they can, their patients can find them easily. For that, I'm thankful and I'm excited about it, but at the same time, like, it shouldn't be the case. Like, audiologists need to be comfortable with earwax removal. Sermon management is part of our scope of practice, and there's no reason why all of us shouldn't be doing this. Since we've become such a big, we've made such a splash with earwax removal with the Earigator, we've seen all kinds of patients. We've seen a ton of patients. We see your typical earwax removal patient, but we've also caught we've even caught tumors. We've caught acoustic neuromas. Patients think that they have, blockage of wax and they've kind of put it off and they have no wax whatsoever. So we'll do an exam instead. And we've caught a few of those already. And I can't tell you how many times people, maybe it's wishful thinking, hope that they have earwax. They don't, they have hearing loss. And then they turn into a hearing aid patient. I mean, just last week alone, we had probably 8 patients that we converted into a hearing aid patient because they didn't have earwax. They had hearing loss and they got hearing aids. So it's a huge deal to not not only not lose these patients to more of an ENT type practice by referring them to that, but also just to be able to help people. Like, they're putting it off. Maybe it's more comfortable for them to say, maybe I have earwax and let me go in and see what's going on. And then they find out that they don't, and then they could talk to a professional about it. It's a big deal that we get to help all these facets of patients from something as simple as them thinking they have earwax. The machine, the Earigator machine itself, just looks really professional. It's not a rinky-dinky machine. It's a beautiful machine. It's sitting on a, nice sturdy cart. The cart is amazing. If you get the machine, you must get the cart. I would also add the little Earigator apron because it's super cute. But the cart has a pull-out drawer that you can put gloves in it. We put all of our, Lysol and things all over it. And then the machine itself, it heats up. It has an indicator light when the water's warm. It's just so easy to use. The nozzle is comfortable. It's not metal, it's plastic. So all in all, it's a beautiful machine. It looks nice. I mean, it's you investing into your company. For the amount of revenue that we've made, I could buy an Earigator machine in one day. That's how much revenue we're making a day on Earigator cleanings, on earwax cleanings. I can buy a machine every day if I wanted to. That's what the Earigator has done for our company. I've hired another doctor. I've hired another front office person. We are booked out 3 months in advance, and we own 3 machines now. It's been probably the biggest thing I've ever done for my practice. And I do a lot for my practice. I make it beautiful. I have fancy cappuccino machine. I have multiple, I have the highest technology. I use best practices, but something, I guess you could say as simple as an earwax machine has changed everything for us. It is a game changer. Earigator is a game changer. As effective as the Earigator machine is with earwax removal, it's not complicated at all. With my latest audiologist, we taught her how to use it within about, 2 to 3 minutes. We practiced on each other, and that was it. Within 1 or 2 patients, she felt extremely comfortable. It's very, very easy to use. There's no downtime, there's no training time. The nozzle can only push so far. You don't have to worry about things like, dangers of it. We do have waivers that we make all the patients sign because everything has risk, but we have not had any problems whatsoever, and it's just been nothing but amazing for us. Again, this is Dr. Elly from Memorial Hearing. Thank you.